you may be too early and come to hospital to seek the treatment. However, you may not be seen in the accident and emergency area, where this is where we come into the place as expert clinician to provide the same-day emergency care. Here we see you early, initiate the investigation, early assessment, and then make a decision in terms of the treatment and get you home so that you can sleep in your bed. However, if it is absolutely necessary to keep you in the hospital, we make sure from your safety point of view, we get you admitted.
As part of the same-day emergency care, we have got numerous specialities that may see the patients. These include medicine, surgical, ear, nose and throat, and now we're delighted to include the gynecology specialist team who will be in-reaching in this area.
This is the same-day emergency care recliner area. You may be placed in here if you need some IV fluids or IV antibiotics, or if you're too unwell to sit in the waiting area.
This area is much bigger than what we currently have to get this kind of treatment. It is very quieter, and as a patient, you are being overseen by the nurses for the patient safety point of view.
This is one of our same-day emergency care consultation rooms. As you can see, it's a lot more space, and we've actually given doctors some computer screens to be able to access information in a far timely manner. This is the Integrated Acute Assessment Unit. You'll find multiple specialities based in this area, such as medicine, surgical, ear, nose and throat, orthopaedics, and now gynecology specialist team.
In a traditional way, you need to wait to be admitted to the specialist ward to get initial treatment and assessment done. However, being the specialty based on the assessment unit, your treatment can be started early so that we can get you home early as well. This is our trolley bay area where you will be admitted for the initial assessment. Advantage what we have now is that we have our own 2 monitors where for certain conditions, if you require the short-term monitoring, we can provide rather than getting you to the specialty ward to be admitted. This helps us to get you home early by making an early decision.
Trolley Bay 3 will have female-only patients, which gynecology in reach into. As we've just gone through a pandemic, you are all aware that it is extremely important to isolate certain conditions in a timely manner. We have now gone from 4 side rooms to 9 side rooms on this department, all en suites. This is our staff area. It's very important that we also improve the facilities for staff, for their health and well-being. We've given them a bigger staff room, and also it's the first time we've given them staff changing rooms that incorporate a shower. The doctors always complain there's not enough computers. We've given them a meeting room with 6 computers in here.
That's really wonderful because now we can use this as a handover room and teaching and training sessions for the junior doctors.
I hope you enjoyed the tour that we've given you today and you found it useful. If you do have to attend this area, hopefully for the new facilities that we give you, will make it a far pleasant experience.